You know that feeling when you're looking at your pet and something just seems a little off?
Mm-hmm.
Maybe some weakness or a strange little muscle twitch, and you start digging online. Maybe you even find a research paper, something dense like canine and feline hypomagnesemia.
Right, and suddenly you're wading through medical terms.
Exactly. Well, you've brought that paper or that worry to the right place. Our mission today is to sort of cut through that complexity.
Yeah, we're going to unpack hypomagnesemia, basically low magnesium levels in dogs and cats.
It sounds a bit obscure, maybe, but turns out it's really important.
It really is. This mineral does a surprising amount in the body.
And we've got an expert here, thankfully, to translate the science into something we can all grasp.
Happy to help break it down.
So the goal for this deep dive,
Right.
what is this condition? Why does it happen? What should you look out for? And really, why does it matter for our pets?
Let's get into it.
Okay, so starting right at the basics.
Hmm.
What are the actual numbers? When is magnesium considered low?
Okay, so for dogs, the official line is usually a serum magnesium level below 1.89 milligrams per deciliter.
1.89. Okay.
And for cats, it's just slightly lower, less than 1.8 milligrams per deciliter.
Got it. And you mentioned it's important. Just how much magnesium are we talking about in the body?
Well, it's surprisingly abundant. Inside the cells, it's actually the second most common positively charged ion, or cation. Potassium is number one.
Wow, second only to potassium. That's significant.
It really is. Shows how vital it is at a cellular level.
So where is most of it stored then, if it's inside cells?
Right, so the biggest reservoir, about 60%, is locked up in bone.
60% in bone.
Yep. And then around 38% is found in soft tissues. Think skeletal muscle, the liver. They hold quite a bit.
Huh. So only a tiny bit is actually floating around in the blood.
Exactly. Only about 1 to 2% is in the extracellular fluid, which includes the serum that we measure in blood tests.
So that blood test, it's not really showing the whole picture of the body's total magnesium?
Precisely. It's just a snapshot of that small extracellular fraction.
Mm-hmm.
Doesn't always reflect the total amount stored in bone and tissues.
Okay, that's really important to understand. So what does this crucial mineral actually do?
Oh, it does a lot. It's an activator or a catalyst for, get this, over 300 different enzyme systems.
300?
Yeah, including really key ones involved in using ATP, that's the cell's main energy molecule, and things called phosphatases, which are involved in tons of cellular processes.
Okay, fundamental seems like an understatement.
Pretty much, yeah.
And the paper mentioned different forms of magnesium in the serum.
Right. So in that small fraction in the serum, some of it, maybe 25–30%, is bound to proteins.
Okay.
The rest, maybe 70–75%, is either chelated, meaning bound to other small molecules, or it's ionized. And that ionized form is generally thought to be the biologically active part.
The active form, got it. But again, remembering that serum level isn't the full story.
Exactly, that's a key point.
So how does the body actually get and manage its magnesium? Where does it come from? How is it kept in balance?
Okay, so absorption happens mainly in the small intestine, primarily the last part, the ileum.
The ileum.
Yeah, though some absorption happens in the jejunum and colon too. But the real regulators are the kidneys. They're key for maintaining balance.
How do the kidneys do that?
They are incredibly good at reabsorbing magnesium, pulling it back into the body so it's not lost in urine. This happens at different points in the kidney tubules.
Okay.
About 10–15% is reabsorbed early on in the proximal tubule. Then the big chunk, like 60–70%, gets reabsorbed in the thick ascending limb of the loop of Henle.
Wow, most of it there.
And then another 10–15% in the distal convoluted tubule. And what's really interesting is that this last part, the distal tubule reabsorption, is actually controlled by hormones.
Ah, so the body can fine-tune how much it keeps or lets go based on its needs?
Exactly. It's a very sophisticated control system to manage excretion.
Okay, so it's tightly regulated. Now let's talk about when things go wrong. Why is low magnesium such a problem? The paper talks about ripple effects.
Yeah, ripple effects is a good way to put it. One of the most critical roles magnesium plays is as a cofactor for an enzyme called the sodium-potassium ATPase pump.
Okay, that sounds important.
It is. This pump is absolutely fundamental for maintaining the electrical gradients across cell membranes. Think of it like keeping the battery charged for every cell.
Right. Essential for nerves, muscles, everything.
Pretty much everything that relies on electrical signaling. So if magnesium is low, that pump doesn't work as well, and those gradients get disrupted.
And disrupting electrical gradients, that sounds like it would cause problems. How does it affect nerves and muscle specifically?
Well, magnesium is also involved in handling acetylcholine. That's a
Hmm.
key neurotransmitter, the chemical signal, at the junction where nerves talk to muscles.
Okay.
If magnesium levels are low in the fluid outside the cells, you can get an increase in acetylcholine activity right at that junction,
Meeting too.
overstimulation,
Yeah.
which can cause things like tetany, sustained muscle contractions, spasms, rigidity. You might see severe tremors.
Oof. That sounds awful for the animal. And the paper mentioned other neuromuscular and cardiac issues from these gradient disturbances.
Absolutely. Messing with those electrical gradients changes the cell's resting state, its readiness to fire, and how it resets afterwards, which is called repolarization.
So it affects the signals themselves.
Right. This can show up as general weakness, muscle twitching, fibrillation, and that tetany we mentioned in skeletal muscles. And some drugs, like the chemotherapy agent cisplatin, can worsen muscle problems, myopathies, especially when magnesium is already low.
And the heart's a muscle too, right? So it's affected.
Definitely. Magnesium influences how calcium moves within heart muscle cells. Calcium movement is critical for heart rhythm, excitability, how easily the heart muscle gets stimulated, and contraction strength.
So low magnesium throws that off.
It can, yes. It affects the pumps in the heart cell membranes, making the cells, let's say, more easily triggered or irritable.
Hmm.
This can lead to tachyarrhythmias, those fast heart rhythms.
Like serious ones.
Yeah, potentially serious ones like ventricular arrhythmias or a specific type called torsades point. You can also see changes on an ECG, like a prolonged QT interval, ST segment changes, wider T waves. It messes with the heart's electrical stability.
That's quite a list. And the paper mentioned digoxin toxicity too. What's that link?
It's interesting, both digoxin, a common heart medication, and magnesium affect that same sodium-potassium pump we talked about.
Ah, okay.
So if magnesium levels are low, the heart becomes more sensitive to digoxin's effects. This means an animal could develop signs of digoxin toxicity even on a dose that would normally be fine.
So low magnesium increases the risk from digoxin. Good to know.
It's a really important interaction for vets to keep in mind.
And finally, on the ripple effects, what about bone health and hormones?
Low magnesium can actually cause the body to become resistant to parathyroid hormone, PTH.
PTH, that regulates calcium, right?
Exactly. So you get reduced response to PTH. And kind of paradoxically, low magnesium might also increase how much calcium gets taken up into bone. It just shows how interconnected all these minerals and hormones are.
It really does. One mineral deficiency having such widespread consequences. So who is most at risk? How common is this?
It seems to be surprisingly common in critically ill animals. The paper cites studies showing it in anywhere from 28% to maybe 54% of critically ill dogs and cats.
Wow, potentially over half.
Yeah, and that mirrors what's seen in critically ill people, where rates are often over 50% too. So it's definitely something vets look for in very sick patients.
That's significant. What are the main ways an animal can end up with low magnesium? The paper mentioned 4 categories.
Right. Generally, we think about 4 main causes: losses through the gastrointestinal tract, losses via the kidneys, endocrine or hormonal issues, and then a sort of miscellaneous group.
Okay, let's start with the GI tract.
Sure. So severe malnutrition is one obvious cause, or conditions that cause malabsorption where the gut just isn't absorbing nutrients properly.
Makes sense.
Also, significant fluid loss, like from really severe or chronic diarrhea. Magnesium concentrations are actually higher in the lower GI tract, so major diarrhea can mean major magnesium loss. It's been documented in humans with secretory diarrhea and even reported in a dog with a protein-losing gut disease.
So major gut issues are a big red flag. What about the kidneys? We know they regulate it.
Exactly. So kidney problems can definitely lead to loss. Certain drugs that are toxic to the kidneys, nephrotoxic drugs like cisplatin, aminoglycoside antibiotics, amphotericin B, can damage the tubules so they can't reabsorb magnesium effectively.
Okay, drugs are a factor.
Also, something called osmotic diuresis. That happens in conditions like diabetes mellitus, where high blood sugar pulls water into the urine, increasing urine volume and flushing out electrolytes like magnesium.
Ah, like an untreated diabetes.
Right. Loop diuretics, commonly used for heart failure or fluid retention, also increase magnesium excretion by the kidneys.
So treatments for other conditions can cause it.
Yes. Other causes include having too much calcium in the urine, hypercalciuria, or certain types of kidney tubule problems, tubular acidosis. The paper even mentions that diuretic-induced low magnesium is a known issue in human heart failure, and even long-term use of thiazide diuretics can contribute.
Lots of potential kidney-related causes. What about the endocrine links?
Certain hormone imbalances are associated with it too. Things like hypercalcemia, high blood calcium, hyperthyroidism, and hyperparathyroidism can all play a role. The hormonal regulation is complex.
And that last miscellaneous category, what's in there?
It's a bit of a catch-all. Lactation, especially with big litters, can drain magnesium through milk.
Okay.
Then there's redistribution magnesium shifting around in the body.
Hmm.
This can happen when refeeding a starved animal or during insulin therapy, particularly aggressive treatment for diabetic ketoacidosis or DKA.
Insulin therapy.
Interesting, yeah. Also, after parathyroid surgery or if IV nutrition, TPN, doesn't have enough magnesium. Acute pancreatitis, another one. Even excess stress hormones, catecholamines, can cause shifts.
So stress can even affect magnesium levels.
It seems so. Other causes are simpler, like just not getting enough magnesium in the diet or not enough in long-term IV fluids or dialysis fluids, and sometimes it can get sequestered, sort of hidden away.
And the diabetes connection. You mentioned DKA, but what about just general diabetes?
Well, the paper notes that in human diabetic outpatients, nearly 25% have low serum magnesium. While one dog study didn't show a big difference in the ionized form between diabetics and controls, it's definitely something to keep in mind, especially, like I said, after aggressive insulin for DKA. Seems like there are just so many ways this can happen.
It really does. Okay, so given all these potential causes and the fact the signs can be vague, how does a vet actually pin this down?
That is the challenge.
Yeah.
The clinical signs: weakness, muscle twitches or fibrillation, wobbliness or ataxia, depression, maybe hyperactive reflexes, tetany, weird behavior changes, even heart arrhythmias. They overlap with so many other things.
Very nonspecific.
Exactly. So you can't diagnose it just by looking at the animal. If you, the owner, see a mix of these things, maybe they seem weak, and the vet notes an arrhythmia that might put magnesium on the radar.
So what other conditions would be on the vet's list to rule out?
Definitely other things causing neuromuscular signs, especially other electrolyte problems like low calcium or potassium, heart diseases, obviously, different types of poisonings, and kidney disease itself.
Makes sense. So how do we confirm it with lab tests?
The key is finding low serum magnesium on a blood test. Usually serum is preferred over plasma,
Why serum?
because some anticoagulants in plasma tubes, like EDTA or citrate, can bind magnesium and give a falsely low reading. Also, you have to be aware of other things that can mess up the result. 4-calcium can falsely lower it. Hemolysis damaged red blood cells or really high calcium or protein can falsely raise it. High bilirubin or fats in the blood can falsely lower it. So context is key.
So interpreting the number needs care.
Absolutely.
Yeah.
And just as a practical note, sometimes results are in different units. 12 milligrams equals 1 mil equivalent, and you divide MGDL by 1.2 to get MEQL.
Good tip. Are there other lab findings that might point towards hypomagnesemia?
Yeah, if you see low magnesium along with azotemia that's high kitty waste products in the blood, it suggests a kidney cause. Finding certain debris, called tubular casts, in the urine might point to kidney tubule damage, maybe from a drug.
Okay.
And very often you'll see other electrolyte issues at the same time. Low potassium, hypokalemia, low sodium, hyponatremia, low calcium, hypocalcemia. Finding those should definitely make you check the magnesium level.
Yeah, they often travel together. Now, the papers stress that diagnosing true depletion is hard because so little is in the serum. Are there other tests?
It is tricky. That serum level is less than 1% of the total body store, remember. And only about half of that is the active ionized form.
Right.
Standard tests measure the total serum magnesium. You can measure the ionized form specifically using special electrodes or techniques like ultrafiltration, which might give a slightly better picture of the active status.
Are those common?
Ionized magnesium testing is becoming more available, but still maybe not routine everywhere. Other methods are less common in practice, like measuring magnesium inside white blood cells or giving a magnesium dose and seeing how much the body holds on to.
How does that retention test work?
In human medicine, they sometimes use it to differentiate kidney wasting versus low intake. If the body retains a lot of the test dose, like over 40–50%, it suggests depletion. If it retains very little, under 20%, it suggests stores are probably adequate.
Interesting. What about other diagnostic procedures, like ECGs?
Things like an EMG, which measures muscle electrical activity, or an ECG for the heart, can definitely show the effects of low magnesium, like those arrhythmias or muscle excitability issues. But they don't tell you why the magnesium is low. They show the consequence, not the cause.
Okay, so let's say the diagnosis is confirmed. Low magnesium. What's the treatment plan?
2 main goals. Treat the underlying reason why the magnesium is low and replace the magnesium itself. The approach really depends on how severe it is and what the underlying cause is.
So mild cases might just resolve if you fix the primary problem.
Sometimes, yes. If you treat the underlying gut disease or adjust medication, the magnesium might normalize on its own. But severe cases, especially with serious signs like tetany or arrhythmias, need intensive care and direct magnesium supplementation.
What about general care while they're being treated?
Nursing care mostly focuses on managing whatever the primary illness is. Activity level depends on their other conditions. Diet-wise, there isn't a specific low magnesium diet. It's more about ensuring balanced nutrition suitable for all their health issues.
Okay, so for the direct magnesium replacement, what's used?
Typically, magnesium sulfate or magnesium chloride. They're given intravenously, usually diluted in 5% dextrose solution.
How is it given slowly?
Yes, it needs to be given carefully. In an emergency, like severe seizures or tetany, a loading dose might be given over 5 to 60 minutes.
Okay.
For ongoing replacement in hospitalized patients, it's usually given as a continuous rate infusion or CRI. There are protocols for rapid replacement and slower replacement, depending on the situation. It's important the infusion concentration isn't too high, usually less than 20%, and ideally given through its own separate IV line
Why a separate line?
to avoid interactions with other fluids or medications.
Right. Are there times when giving magnesium is risky or needs extra caution?
Yeah, definitely. You generally want to avoid aminoglycoside antibiotics if magnesium is low, because the low magnesium can make the kidneys more vulnerable to damage from those drugs.
Okay, good point.
Cisplatin is also contraindicated. If the animal's on digoxin, you'd want to stop it if possible during magnesium therapy. Diuretics need to be used very cautiously, as they can worsen magnesium loss.
And you can give too much.
Yeah.
Absolutely. You have to monitor carefully to avoid causing hypermagnesemia, magnesium levels getting too high. Animals with kidney disease are at higher risk for this, so they need lower doses and more frequent checks.
What about interactions with other drugs being given IV?
Yes, magnesium sulfate can be incompatible with some common IV drugs, like sodium bicarbonate, hydrocortisone, and dobutamine, so don't mix them.
Okay.
Also, avoid giving calcium-containing fluids or drugs at the same time if possible, as calcium can sometimes lower serum magnesium. And be aware magnesium can increase the effects of sedatives, anesthetics, and neuromuscular blockers.
So lots of potential interactions to watch for.
And use it cautiously with digitalis drugs like digoxin because of potential combined effects on heart conduction. Calcium supplements might also counteract some effects of IV magnesium.
Clearly, careful monitoring during treatment is essential. What does that involve?
You typically monitor serum magnesium and calcium levels daily. And continuous ECG monitoring is really important during the infusion to watch the heart rhythm closely.
Makes sense. What happens if severe hypomagnesemia isn't treated?
It can be fatal. Those effects on the heart and neuromuscular system can be life-threatening if not corrected.
Wow. So what's the overall outlook? The prognosis?
It really depends almost entirely on whether the underlying cause can be fixed. If you can resolve the primary disease, the gut issue, the kidney problem, the hormonal imbalance, then the prognosis for correcting the hypomagnesemia itself is generally good.
Okay, that's hopeful. So let's try to wrap up this deep dive. We've seen magnesium is, well, way more important than maybe we thought.
Absolutely. Vital for hundreds of processes.
And low levels are pretty common in really sick pets, causing a whole range of vague signs, weakness, twitching, heart issues.
Making it tricky to spot sometimes.
And the causes are so varied. Gut problems, kidney issues, drugs, hormones.
Yeah, lots of potential triggers. And diagnosis relies on blood tests, but remembering serum levels are just part of the picture.
Right. Treatment involves fixing the underlying cause and carefully replacing magnesium, watching closely for side effects and interactions.
That's the core of it.
I think the big takeaway for me, and maybe for you listening, is that low magnesium is often a symptom of something else going on.
Exactly. It's usually a consequence, not the root problem itself. Finding that root problem is key.
So hopefully this discussion has shed some light on that complex research paper, or just helped you understand this condition better if it's something affecting your pet.
It really highlights how interconnected everything is in the body, doesn't it? A seemingly small mineral imbalance has these huge ripple effects.
It really does. It makes you wonder what other minor things, other minerals or nutrients, might be having significant impacts that we don't always think about.
That's a great question. Maybe exploring some of those other hidden players could be the topic for our next deep dive.